Thank you. I'm going to introduce Elaine Fulton, who's now director at Elaine Fulton Consulting. Many of you will know Elaine from her work over many years in the public and charitable sector. And more recently, you will probably have come in contact with her in her work in developing a common outcomes framework for children and young people. She's really passionate about making a difference for children and doing that through a collaborative, innovative approach. And she's going to talk to us today about her work in developing a common outcomes framework. And more recently, she's been working with the community of practice in London that I facilitate to look at how we can use that framework in family hubs to measure and to record our outcomes. So I'm going to hand over to Elaine. The other thing to say is that we're really grateful to have Elaine today because she's actually going on holiday today. So she's going to be leaving to catch a plane as soon as she finishes presenting. So thank you very much, Elaine.
Thanks very much, Jane. And I'm just so pleased to be here. If only online, as Jane explains why, and really grateful for the opportunity to share the work I've been doing with Jane and the London Community of Practice and our efforts towards developing a common approach to outcomes for all babies, children, young people, and in particular focusing on, obviously, on family hubs. So if I could have the next slide, please. Hopefully that will work. Brilliant. And just to say, my slides are pretty busy. I don't expect you to be able to read through and go through all of the detail or even to be able to read it. But I do want everybody to get the slides and get the detail afterwards. So I've only got enough time really to give you an overview of what we're doing and obviously encourage you to get in touch if you're interested in hearing more afterwards. And so what we're doing, as Jane has said, we're responding to requests that came through a meeting earlier this year from the London Community of Practice, who were all, as I'm sure you all are, and all very aware about the desire to find a way to more accurately and appropriately reflect and capture the outcome of family hubs for babies, children, young people, and families. And the aim is to do that, and in particular to focus on that unique contribution and to how we can demonstrate the effectiveness of family hubs within that wider system, children's services and beyond. And what we've done is we've very much taken that initial focus on the babies, children, young people themselves. And then, as you'll see when I share the framework with you, represented what it takes to support and deliver those outcomes, in particular around parents and carers' own circumstances, and then the wider system and service level performance and activity. And Jane said it's a really fantastic opportunity for us not only to link to the wider children's outcomes work and create something consistent for family hubs, but actually feed into that work, as I'll demonstrate in a moment. Key to say is that we are, although I would dearly love to achieve perfection in this, we are not thinking we will achieve perfection, but a consistent starting point for everyone to start to test and extract our learning, share our learning, identify gaps and priorities for action. And that action isn't just for those involved, it's action across the system and into the wider work, which if we could have the next slide, please, I will just remind people of quickly. There's a huge amount more about this. Do get in touch if you want to find out more about what has really evolved from a very small starting point into a big coalition of stakeholders working together, really collaborating to attempt to address a systemic problem. And to deliver our shared vision of better and improved outcomes for all children, babies, young people, and that they're all safe, happy, healthy, learning and engaged. And we're aiming to have a broad consensus of what success would look like, rooted in what matters most to them and for them, and defined and measured more consistently, efficiently and effectively. So really focusing our efforts on what matters. And we've developed as part of this, and this is our starting point for this work I'm talking about today, a high-level framework, which is not meant to be a rigid top-down outcomes framework structure, but an opportunity for exploration and developing and finding ways to collaborate. The next phase of the work, you'll see the logo on the slide here. The Common Outcomes for Children and Young People Collaborative started in September, now hosted by our incubation host, Dartington Service Design Lab. And it gives us a lot more opportunity that I won't go into because I haven't got time. But as I say, do get in touch if you want to know more. And then the next slide shows you the latest and very hot off the press iteration of the high-level illustration of what a framework could look like. It's been redesigned, but also it's the feedback we've had in since the last version has been fed in, and really particularly I have used the experience of the work with the London community of practice to input into this, and I hope when they look at it they will see their influence in this. So it's very much evolving collaborative process, as Jane has said. So to move on to what we've done, so we have reviewed lots of existing outcomes frameworks and approaches, and in particular, and particularly useful, I find the work that's going on at the moment in terms of an list of indicators for the Start for Life programme, to help structure and think about what we were doing and the framework that we were developing. And what that really helped as we pulled together a small working group from the community of practice was to untangle the various elements that are there when we think about family hubs and outcomes, and in particular to start with that focus on outcomes for babies, children and young people across the 5 domains, and to stick with that structure that I showed you a moment ago, and also attempt to use the language and terminology that wider common outcomes work has used. And in effect, we're modelling and addressing one of the problems in the system, is that we talk about this work and we confuse and use some of the language interchangeably. So we're trying to be consistent in that way, but starting with a strengths-based approach to outcomes for babies, children and young people, and then think about across the outcomes what needs to be in place for parents and carers, and then what are the service system level indicators of performance and the metrics. So you end up with a structure that helps you tease things apart and think about it in hopefully a more logical way. And a couple of things to clarify, which I know you all know this, but just to make sure, when we're talking about Family Hub's delivery in this, we mean all of that delivery, and we mean it's the contribution through direct delivery and commissioned services, but also as a gateway to other services. And this was something that came out really clearly, but is so difficult to represent, which is the role of a family hub and that wider impact and ripple effect by being there, building relationships and making connections within communities. So that's really part of our thinking. We then prepared worked examples and then refined it, and it's an ongoing iterative process. Quickly to say also that for parents and carers, what we're talking about is anyone with parental responsibility. And I will say it explicitly because I heard fathers mentioned earlier, and it has been raised. We do mean mums and dads. We mean co-parents, whether they're together or separated, no longer together, anyone, as I say, with parental responsibility. So next slide, please. And again, I don't need to go through these probably because you're all very aware of all of the challenges and complexities of thinking about this and taking action around an outcomes framework. The word cloud from the Menti earlier today, I thought, God, this is just, I could have written this from what everybody was saying. I've written down confusing, challenging and complex, but I've also written down exciting and inspiring and hopefully transformational. I mean, that's how I find this work, but the key word for me is transformational, and in particular, how we can focus our efforts so we know we're delivering the impact that we're seeking for and with babies, children, young people and families. So just quickly on those challenges, the first, as I've said, how to keep a clear but also strengths-based focus on outcomes. So it isn't focusing on those things we're avoiding, but actually genuinely, how can we demonstrate movement towards positive outcomes? And that is more or less difficult looking across the framework, as you'll see when you get the detail, but we're striving for that. To really represent older children and young people's outcomes across the age range. We're dealing with that complexity that, of course, family hubs are different everywhere and exist within complex networks and systems that are themselves different. It's also very difficult for us to focus on the specific and unique contribution of family hubs within that system and within those systems. And what we've picked up are the fact that existing metrics that are used can suggest an unrealistic level of impact. We had an example where in a previous children's centre reality that a children's centre was held account for the local child obesity rates in the local population. So again, it's really trying to think, how can we focus on what's within the gift of family hubs realistically, while not underestimating that impact. We know there are gaps, that the data may not be there, the measurement tools may not be there, that will deliver what we need for family hubs contribution. I've already talked about the role as a gateway, and we may not be able to find the data that we need to demonstrate the impact. However, going into this, we understand those gaps, but we are starting somewhere, and most importantly, we're not alone. And that's why having this work nested within that much wider piece of work around common outcomes, some of the resulting actions will be local and with us, some will be across family hub systems, and some will come through that wider piece of work, which I hope is reassuring. So next slide, please. I think I probably said most of this, but in particular, I think one of the challenges for us is to balance consistency with uniqueness in terms of what's shared across areas and across the system in terms of a framework, an outcomes framework, and then what would be added to in relation to local circumstances. So that's where we're at. We're trying to find consistency where it makes sense, but not drive a consistent approach where it doesn't make sense. So again, a tricky balance, but that's what we're working towards. And I think we've probably said all of this already, or I've already said it. So next slide, please. So this is, and I'll say quickly, I have made this, it's not been designed, so it doesn't look, I'm sure, hopefully one day it will look a bit better than I've managed to do it. But this is the outline framework. As I said, with babies, children, young people at the top, their outcomes, indicators and metrics across the 5 high-level outcomes from the wider outcomes framework, nested beneath the parents and carers, and then beneath that, the indicators and metrics relating to family hubs performance. And when I say family hubs, I mean within that wider system as well. So next slide, please. So we have tested this through various iterations. And again, I apologize, you will not be able to read the detail here, but you will get it. And what we've done in terms of that challenge, we put lots of detail in, we've stripped it out. But what we're seeking is a good starting point to test, where it's not overloaded with detail about particular cohorts of children and young people or particular policy areas. It is informed by all of that. So hopefully when you see it, you can see those threads going through. And in particular, the worked examples start at the top and work their way down from the outcomes, indicators, metrics, down to parents and carers, and what the system needs to do, as you'll see here, to be able to deliver on that. And the other thing to remember, we put it in italics here, is we're looking at for those, this is the impact for those accessing family hubs. One of the challenges is also how we might differentiate and compare impact and what's happening for those accessing family hub services and those who aren't, but that's all part of this challenge. So as I say, this is really trying to focus on outcomes. the indicators and metrics. It's not, we've had tension as well. How might we represent in this, maybe some of the activities you're doing to deliver them and all of that detail. So although we're not putting that in here, we do see this as a framework. I keep saying I need a new word instead of framework, but a way to layer across, build up a view of the data that is available, and then think about the actions that are happening and what's being commissioned and delivered against this framework. And then that starts to give a picture of that sort of gives you the background for plans and strategies. So it is an outcomes framework, but it is, hopefully the aim is that it gives you a structure that you can build on. So you've got that golden thread or the thread from outcomes all the way through to everything that's going on. So we can go through, that's the first slide. We then go to the next one, which is the parents and carers one, and then the final one, which is the Family Hub's performance. And I should say that this version has already been updated and changed since I sent my slides across because we've had more input. So the final slide will take you through the next steps. There will be a further iteration, which is going to go out this afternoon from the small group out to the wider community of practice with some prompts for them to do a bit more testing by the start of November. So really checking it against the local offer and coming back with their suggestions and observations. We'll then assimilate, and then we're going to pilot this across probably about 7 of the areas in London from November to the end of February. And a subgroup of a few authorities are going to do some of that legwork to pull together the data sources that should be and are available to every area so that everyone doesn't have to find all of the same data sources. So we're trying to make it as efficient as possible. Then we'll pull together the learning and come up with priorities for further development, share more widely in March. And as it says here, please get in touch with Jane in person if you're there today, or by email if you're interested. We would like, obviously we want people to start using this, but it would be really good to hear who's doing what with it if you are doing anything, and also to feed into that wider learning. And as I say, it will continue to fit with the wider common outcomes work, inform it, and also have that two-way process. So I think my last slide just says thank you. So I will say thank you, and that is the end of my presentation. And yeah, do get in touch if you want more information. Thank you.